Nasser Cunningham. I currently work with Prevent Child Abuse America, but we call ourselves PCA. Before I talk to you today about why I'm actually here, let me go over the importance of home. Home has been a very important part of everyone's life here, I assume. It shapes the very foundation of who we are before the outside world gets to see us and how we interact with it. Good home life is crucial for kids. As we know, they need a space where they feel free to express themselves, despite even their craziest intention, or a place where they feel loved unconditionally, or even just teach them responsibility. Our main focus here at PCA is trying to reach out to these families. As it states now, we are currently operating up to 38 states, meeting up to 70,000 families per year. I know, it's a pretty big number, I'm stuttering on it, but my bad. So, with that being said, our main focus is trying to expand our reach, get to these other states, and make a difference there. So what I'm here to ask for is a donation from you all. To get you to donate though, I will be going over the effects of child abuse, well, the rates of child abuse in America, its effects, and how our program benefits these parents and children individually. Starting off, it's been my desire to say that we currently don't have as much up-to-date info as we need. But in 2021, we have up to 600,000 reported cases of child abuse in America. Another program that deals with the same thing, Mandated Reporter, has reported up to, sadly enough, 1,820,000 cases of child abuse fatality. In 2022, is marked up to 1,990. These records, this data is heartbreaking to look at, as we currently do not have the up-to-date records on child abuse fatality. And this has been made worse with COVID recently. As during COVID, a lot of us had to isolate or distance ourselves for our own safety. Along with this, so did kids, whether they wanted to or not. Families also lost some crucial people during this time period. Parents, siblings, uncles, cousins, that one guy that knows your order at Chick-fil-A. With that being said, food insecurity, financial instability, and grief have been all stress factors on these parents. And for some parents, they have aimed this at their children. Our main thing is we have specialists trained to be attuned, nurturing, and responsive for these parents in need and these children. With that being said, I know your main question is how effective really are these visits that you guys make every year? With that being said, we have received the highest rating known from the California Evidence-Based Clearinghouse, also known as the CEBC. And along with that, U.S. Senator Ron Wyden has stated, in his opinion at least, that we are the best program, dollar for dollar, that when it comes to this sort of thing. But beyond that, we try our best to be attuned. We try our best to work for both the children and the parents. For kids specifically though, we try our best to help with education, as some in a bad situation may find it hard to focus purely on school. And for others, we provide counseling for the aftermath of what they have been through. Specifically, we have shown in our first experience that they are 13.2% more likely to excel at all 3 learning behaviors. Adding on to that though, children in our program are known to need special education services in school 26% less than average. Another thing I'd like to add on is that we're going to take this one part serious, because when it comes to child sexual abuse, we have seen up to 47,000 official cases in 2018 alone. National Children's Alliance has reported up to 236,000 investigated cases, with only 55% of them being carried through the court system. And there's one thing we're trying to do, we're trying to get ahead of this number, and to help these kids in the aftermath of it all and deal with PTSD caused by these events. But on a brighter note, we do try our best to help when it comes to the healthcare and well-being of these families, especially when it comes to lowering the low birth weight of children. We've helped reduce that by 48% in families. So yes, you can have your chunky baby. But along with that, we also try to work with the community that these families live or stay in. We try our best to provide parents that are struggling with jobs through our program. It's actually been shown that parents that are enrolled under us are 5 times more likely to enroll and stick to a training program. Along with that, we try our best to improve parent-to-parent relationship, as even though you may be the ones fighting, your kids can still be the ones affected, even indirectly. As such, we try our best with counseling in between these parents, along with helping them deal with more positive coping mechanisms, so that way they don't show anything to these impressionable kids that they can accidentally pick up in the future. And all this being said, I know that we're not the only ones trying to be ahead of us all. But the main thing I'm trying to say is we want to be in the forefront of it all. I know we only operate in 38 states, and for some they may be a lot, but with these records, I'd like to state that these are underreported actually. A lot of people don't have the courage to come forward to actually report such findings to us. So if we can at least up our range, we can get to them more. So my only last question to ask you all is, will you please donate so we can make it to these last people so they can speak up? Is there any questions or reasons why you should donate? I'm listening.
No.
I thank you all for your time today.